Hello, Dr. Alicia. How are you doing?
Hi, Dr. Bruni. I'm good. I'm good.
Awesome, awesome, awesome. So I can tell you are really enjoying the out life, and it's summer and
Yes,
things
it
are
is.
good. Yeah. So how is everything going? With everything you've been through and how you've come this far in your journey.
So it was it was a long journey, yes. So
Mm-hmm.
I started off with, doing my MCQ part one, and
Mm-hmm.
then I went on to doing my NAC exam, and then I was looking basically, for a pathway that because I've been practicing physician, internal
Sure.
medicine first, and then I did family medicine for 4 years. And
Beautiful.
I was looking for an option to, work in Canada.
Mm-hmm.
So I was looking at the practice ready assessment route
Mm-hmm.
and which province would offer me or which, pathway would offer me the best opportunity.
Mm.
Came across Saskatchewan and then, I decided, okay, this is one of the provinces I would consider.
Beautiful.
And I started looking at to applying and I started to apply and then I got accepted to this program and
Mm-hmm.
I got accepted to the TDM exam. Now, the TDM is the therapeutic decision making exam,
Mm-hmm.
and all foreign international medical graduates have to do this exam prior, to be able to get into the practice ready route.
Okay.
Um, so, in terms of when I got the acceptance for this exam, I
Mm-hmm.
started looking how to prepare.
Mm.
I had really wasn't sure. I didn't have any idea what to do, what resources to use, which books, anything at all. And I just started researching online, and I came across MedCognito,
Okay.
and
Okay.
I looked at previous reviews actually, and
Okay.
they were all really good.
Okay. So is it only the issue of reviews which attracted you to MedCognito, or what else? What else about MedCognito really got you thinking, maybe I really want to work with this team of doctors?
Right. So what got me is that the detail oriented that he had available, well, the team of doctors, sorry, had available.
Mm,
There were videos, there were resources, support, even from this great team of doctors I worked with. They
mm,
were very much willing and accessible at any particular time. They were willing to answer questions and, just all that I saw from them. And then, yes, the reviews were I would say the reviews were a big part that attracted me. And
okay.
then too, there's a very high pass rate. The
Mm,
pass rate is, I would say, almost 100% with MedCognito,
mm,
especially pertaining to doing a TDM exam.
okay. So coming back to that, how rigorous was the training for the TDM exam? And how simple was it for you to really imbibe the principles of therapeutics and management of common medical conditions?
So the exam it takes you have to be, you have to put in the work, and it
Mm,
is a very thorough exam. You have to be, well, very wide in your knowledge base.
mm-hmm,
And I believe that, in terms of preparing and MedCognito, they offered you a very detail oriented as well as vast in terms of topics. It's very
mm,
vast in terms of what they offer.
mm,
Detail oriented, and the videos were amazing. It targeted every single topic that as a family physician practicing in Canada, you should know.
mm,
And that was, I think, what was really the catching point for me. It prepared me well for the TDM exam.
mm,
I can't really say if there were any questions on it that I wasn't able to answer
mm,
to my best. And I'm luckily I got through and I passed with,
mm,
studying because I used a lot more of the notes from MedCognito
mm.
and just my other knowledge. And I think that is what really helped pull me through.
Sure. So in terms of the learning environment and the relationship with your colleagues and the teachers, how will you put that as well?
So one thing I know, the group of doctors always mention that studying in groups and having that support system is very important. I
Mm,
was actually able to connect with other people and we studied, I would say, every night with this group using MedCognito notes,
mm,
as well as the notes and, just other resources that they may have had available.
mm-hmm,
And when we came across any difficult questions or answers, we always reached out to the team of doctors available at MedCognito who responded very, very quickly and
mm.
gave us that answer support that we needed
Okay.
during that period.
Sure. Sure. So with all that, Was it just a preparation for this exam or a preparation for, family medicine practice in general that you really like about this whole program?
So I think, so yes, definitely. It wasn't just for the TDM exam. It definitely everything targeted for your practice in Canada as a family doctor. And I think everything that, that's all the notes and everything on the videos that were available, that's what really helped me to be able to practice as a physician in Canada here and be able to see my patients, and that patient-centered care that they very much want is something that, I really worked. I got that base from this team of doctors.
Beautiful. So will you say you are well prepared, well oriented towards what you need to do and what you need to expect when you step out there to save people who come to you seeking medical advice then?
Yes, I definitely think, everything that that course offered, not just, as in terms of you being able to treat, diagnose, and treat these patients, but just overall how you handle a situation, how you go about treating your patients and interacting and building that rapport. This is what MedCognito offered, an overall holistic approach, not just about, treating and seeing a patient, but also being able to, work and just give back to the communities, you would be working in.
Beautiful. So, in summary, if someone asks you, so Dr. Alicia, tell me, in bare bone facts, what should I do when I need help with my Canadian Medical Exam Board prep? What will you tell them?
So I would tell them, just go to MedCognito. I think the team of doctors, they are great. They offer you everything. It's not just about, the TDM exam. They offer other things as well. But even if you just need guidance on where to start, like how do you go about even trying to get into the Canadian medical system? I think that's a great, they have the doctors that you can just approach them. They're readily available to speak to you, and they give you great advice, guidance throughout your entire path into getting into Canada. Awesome. Not just, for the exams, but everything else that you need to do to really try to integrate and get to that point.
Sure. So Dr. Alicia, from here, where are you going? Like going to the mall or what? Are you going to relax? I'm sure you're tired. You need to really take some time off and do a lot of things, hey?
Yeah, so I'm just going to grab something to have some dinner soon and just relax for a bit.
Awesome. Sure. Congratulations once again and all the best in your endeavors. We are very grateful and we are very happy that we are part of this awesome journey. And all the best all the best in the future. Okay? Sure. Okay.
Thank you.
Bye.
Thank you.
Sure.